You are working on a new novel. You are brainstorming characteristics of your protagonist. As often occurs, your character develops independently in your mind. You come to know your character better and discover that he or she has a mental illness. You may not realize it, but you, as an author, have just inadvertently become a voice and advocate for a whole silenced community. Hello, my name is Kaylee Kessel. I am a writer, a mental health activist, and have suffered from mental illnesses for the majority of my life. Over the past 4 years, I have dedicated my time to writing and speaking out about mental health. I have organized projects working towards destigmatizing mental illnesses. I have actively led group discussions on the topic. I have participated in a social group for those suffering called Stop the Scars. I have even written about my own struggles on my blog, Old Soul, Young Heart. Today, I would like to speak to you about tackling one of the most complex topics in your writing, mental illness. As authors, we frequently choose to take on difficult subjects which we have not personally experienced. Cancer, death, religion, abuse, all of these topics are tricky to discuss in a manner which is both sensitive and factual. However, these topics are distinguishably different than mental health. The general public understands and has a basic knowledge of the former topics. Thus, you can write your story without wondering if you're properly representing the community of people whom it applies to. You don't have to be concerned with the audience's lack of understanding or empathy. This is not the case with the latter. Historically, anyone vocally suffering from mental illness has been ostracized from the community and locked away in insane asylums. Xenophobia led to the development of incorrect stereotypes. People believed we were criminals and dangerous. They locked us away in fear they would catch our crazy. They thought we were possessed by evil spirits or being punished for our bad deeds. They stripped us of our humanity simply because they didn't understand us. While there is little that extreme today, stigma and shame still surround the subject of mental illness. People are uneducated on what causes mental illnesses and what it's like to really experience them. Therein lies the question, what can you do to best portray the issue which your protagonist faces to an audience which is ignorant? Firstly, increase your personal understanding of the issue. Chances are that unless you yourself have suffered from mental illness, you don't fully comprehend the effects it may have on a person physically, emotionally, and socially. The more you know, the more your audience will know. To get a better understanding, here is my list of some things that people don't realize about mental illnesses. Mental illnesses are relatively common. According to the National Alliance on Mental Illness, every year approximately 1 in 5 adults and 1 in 5 youths suffer from at least one. This only appears to the public to be a smaller number due to the lack of conversation surrounding mental health. Mental illnesses can have physical symptoms. Not only do they affect thoughts, mood, and behavior, they can affect sleeping patterns. They often cause muscle aches and headaches. They can result in a lack of eating or overeating. They can physically exhaust a person to the point of being unable to get out of bed. There are most definitely physiological connections. Not all mental illnesses involve psychosis. The idea that a mentally ill person goes insane when faced with psychosis is a lie fed to the people by media. Insanity is solely a legal term. Even so, the idea of people going crazy and hearing things and hallucinating only happens with specific severe types of mental disorders. This does not guarantee that someone with a mental illness will have psychosis, and it doesn't guarantee that someone who does have psychosis will be mentally unstable. There is a spectrum which leads to different degrees of effect, and oftentimes people with psychosis who receive proper treatment can lead healthy, functional lives. Medications are not always the only answer, and neither is therapy. Typically, mental health patients receive a combination of treatments involving anything from antidepressants to group therapy to psychoanalysis to classes on coping mechanisms. Choosing one path of treatment will not often be effective enough for full recovery. Lastly, mental illnesses are caused by multiple factors, and one of them is almost always biology. There are two parts to the phrase mental illness. Mental, meaning the brain, and illness, meaning a disease which causes misfunction of the body. Most people realize the connection with the first part of the phrase. But it is important to realize that these are real illnesses, just like diabetes or Crohn's syndrome or epilepsy. Illnesses can be treated, but they are still a constant struggle. They are frustrating, debilitating, and uniquely affect individuals. Mental illnesses are no different. This obviously is not a comprehensive list, and doing some research in more depth would only benefit you as an author. You can achieve this by reaching out to people who have suffered from mental illnesses. Go to support groups. Speak to psychologists in the clinical psychology field. Learn about what these individuals' day-to-day lives look like. Find out what it's like to live with a mental illness in our society. Next, you must address the stigma in your writing. A large part of suffering from mental illness involves isolation from people around you. Even those surrounded by the best support system struggle to be heard and valued in a society if they suffer from a mental illness. To give examples of this, I'm going to read a short excerpt from the poem What Stigma Sounds Like by Fortessa Latifi. Stigma sounds like, this wouldn't be happening if you were stronger. Why can't you just get better? It's your decision. What is there to be so sad about? Just get out of bed. Wash your hair, you'll feel better. Go to the gym, you'll feel better. Stop thinking about yourself so much. While you're at it, stop thinking so much. People have gone through so much worse and they're fine. So what's wrong with you? Why can't you be fine? Just cheer up. You get enough attention already. This is the best time of your life. You should be enjoying every minute of it. Why are you wasting it? Maybe if you spent your time helping other people, you'd see what real problems are. It's all in your head. It's all in your head. It's all in your head. These things which Latifi writes of hearing are frequently heard in variations by almost every openly mentally ill person. They can be quite damaging to a person's self-esteem and lead to a worsening mental state. While outsiders may say this to help or because they don't know what to say, it leads people suffering to push others away. Without addressing this very important piece of mental illnesses, you are missing out on a whole range of the reality faced, and your story will likely fall flat. Another thing you can do to reach the audience is to show a very honest depiction of mental illnesses. One of the biggest dilemmas which mentally ill people face is looking at the media and seeing their community poorly represented. It is sadly a common occurrence. Frequently, these stories are romanticized to be seen as beautiful, or they're shown as being sob stories. This is not usually the reality of the situation. Many mentally ill people live very normal lives. They aren't abused or neglected, they aren't bullied, and they aren't saints either. These people try to blend into the crowd. It's as simple as that. The suffering they face is often internal. Their self-harm or their addiction or their suicidal thoughts are things they hate about themselves. When they get to this point, it is only because they are so desperate for anything that may help. It is not beautiful. It is not something to canonize or emulate. It is just a state of being. To depict it in any other way is cliché and counterproductive to your storyline. Lastly, remember these important points when you are writing. People with mental illnesses are still people. Their humanity and personality are just as important developments to their story. Do not let their mental illness define them. Mental illnesses can happen to anyone. Your character does not have to look or act like a stereotypical depressed person. They can be the class clown, or the ballerina, or the straight-A student. They can be the nurse or the doctor or the police officer. They don't have to live extraordinary lives. Most importantly, be authentic and true to your character. Everything I have written about mental illnesses and depiction are simply generalizations. They are warnings to heed, and I advise you to consider them. However, you know your character better than anyone else, and you know what is right for them. Good luck with your writing endeavors, and thank you for your time.